Hey, what's going on, guys? Welcome back to another video. Sorry it's been so long. I've been so busy this last year doing my third year rotations, but luckily I am 2 weeks away from being done with third year, so I'm super excited about that. So in today's video, I really want to give you guys kind of just some advice about third year, some tips and tricks, kind of how to set up your rotations, what to expect from each rotation. But keep in mind, these are obviously my own opinions. And if you ask any other third or fourth year medical student, they're all going to give you different answers. So definitely take this video with a grain of salt. And so with that being said, let's start off with how I would recommend you guys set up your third year rotations. I really liked the order in which I did my rotations. And so I'll share that with you guys right now. So basically I started off with family med, followed by pediatrics, then OB-GYN, then psychiatry, then surgery. Then I went into internal medicine, and then followed by my elective rotations, which I got 2 months of electives, and I did both of them in emergency medicine, which is essentially what I'm planning on going into anyways. I really liked the flow of how my rotations went because it started off very broadly with family medicine. And in family medicine, you're going to see a little bit of everything. You're going to get really good with diabetes meds, antihypertensives, asthma, COPD. So you're going to see a little bit of everything, including dermatology, and you're going to be able to dabble in a few procedural type things like suturing and splinting and using the liquid nitrogen. So you're going to get very good exposure and a really good base in order to propel you through the rest of third year. So if you can, I would highly recommend starting with family medicine. Obviously, that's not going to be the case for everyone. But it's just kind of what I would recommend. So then next I went into pediatrics, which I thought was also very broad, very similar to family medicine in that you're going to see a wide range of pathology. Now this may differ for some of you because some of you are going to have to do inpatient pediatrics. I did outpatient, so I can't really speak on how inpatient will be. I've heard that inpatient pediatrics is pretty intense with regards to the schedule. It sounds like you guys are going to do a lot of hours in the hospital, but obviously I haven't been there and I haven't done that, so definitely don't quote me on that. As far as outpatient pediatrics, it's very similar to family medicine. The only difference being that all of your patients are under the age of 18. And in reality, most of your patients are going to be under the age of 12. That's kind of my experience. So you're going to be seeing a lot of babies, a lot of infants. And essentially your preceptor will probably have, a set of questions that they want you to ask all of your patients regarding, are they eating and drinking okay? What's their energy like? How much screen time are they getting? How are they doing in school? How is their behavior at home? And so it's just a lot of screening questions, a lot of questions just to see how the kids are doing overall. And so one big difference that I noticed between pediatrics and family med is the amount of prescriptions you write. So in pediatrics, we rarely prescribed medication, which was kind of weird. But if you think about it, most kids actually come in with viruses. And so obviously there's no treatment for viruses unless they end up getting a superimposed bacterial infection, or if they're coming in with just like strep throat or otitis media or some sort of bacterial infection. So unless it's bacterial, you're not really going to be prescribing medication. Now, there is definitely an increase in ADHD, and so you may or may not get familiar with ADHD medications. It's definitely going to come down to your preceptor's comfort level when it comes to prescribing ADHD medications. Otherwise, you're probably going to send them to like a pediatric psychiatrist to kind of handle the mental health, anxiety, ADHD type meds. So that's kind of my experience with pediatrics. We did do a few procedures. You will see, circumcisions. You might even get experience with suturing, but a lot of it is mostly screening questions as well as making sure everyone's up to date on their vaccinations. My next rotation was OB-GYN, and OB-GYN was one of my least favorite rotations. And that's just my own personal opinion. A lot of people love OB-GYN, and this was my first inpatient experience as far as rotations. And it was not a great one to start off with because we had to get to the hospital around 4 in the morning to pre-round. And if you guys don't know what pre-rounding is, that just means as a medical student, you get to the hospital extra early, even probably before your residence. You are generally assigned 1 to 3 patients, and then you go and see those patients. You see how they're doing, if there were any issues overnight, kind of get a brief history of how they're feeling, their pain, their nausea, just whatever they're there for. And for OB-GYN, obviously, they're either prepartum or postpartum. So you want to just get a good idea of how they're feeling overall. If they have any incisions, you want to make sure to look at the incisions, make sure they're not getting infected, make sure their nausea is controlled, make sure they're having bowel function, stuff like that. And so that's pre-rounding. And then after pre-rounding, you'll do rounds, and that can consist of you presenting your patients to the residents and then seeing them with the residents. Or in our case, for OB-GYN, we all met up in a little conference room. The med students would present the patients that they saw to both the attendings and the residents. And then the residents would fill in any gaps that you guys may have missed or just key points that the attendings need to know about your patients. The residents will always see the patients that you guys see, so don't feel like you guys need to get all of the information. Obviously, do as best as you can, but the residents are there to kind of supervise you and just help you. So once you present your patients in rounds, then everybody kind of breaks off and does their own thing. The attendings will go see all of the patients. And OB-GYN's a little bit different. So I don't think I'm going to have a ton of time to get into it in this video, but I'm happy to make another video going more in depth on either all of these core rotations or specific ones that you guys request in the comments. So just let me know. But in OB-GYN, you're going to be probably scrubbing into C-sections. Hopefully you're going to be doing some vaginal deliveries. You're going to be doing histories and physicals on patients coming in with nausea, or they might have a complaint of like, I haven't felt my baby move in a few hours or a day or two. Those are definitely emergent. So the resident will definitely probably see those patients with you as well. But overall, OB-GYN is kind of a watch and wait type of rotation. Unless somebody's delivering a baby, you're kind of just sitting around waiting for either patients to come in or for deliveries to occur. Other than that, you're really watching the fetal monitors and making sure that the fetuses are doing okay. Now, that's a lot on obstetrics. Now, there is also gynecology. And depending on where you're at, you may only do obstetrics, you may only do gyne. But if you do gynecology, that's going to be in a clinic setting, and it's going to be very similar to kind of family med. It's obviously going to be female complaints. You're going to do a lot of birth control, a lot of pelvic exams, stuff like that. So yeah, good times. So the next rotation I did was psychiatry. I really enjoyed psychiatry. A lot of people say they don't really love psychiatry, but you're going to see a lot of psychiatry in most specialties. So it's going to be really good for you to get familiar with those medications. And honestly, psychiatry is a lot of trial and error. You don't know which medications are going to help your patients out. There's obviously first-line medications that you'll start with, and then you can titrate those medications up. Or you can add in other medications, you can switch medications. I think one of the biggest teaching points in psychiatry is knowing the side effects of the antidepressants and the antipsychotics, because a lot of psychiatric medications are actually used based on their side effect profile. So some are actually just used as sleep aids, even though they may be an antidepressant or an antipsychotic. A lot of the times we just use certain ones for sleep, and other ones we might just use simply for anxiety or social anxiety. Other ones are more mood stabilizers. So it's so important to kind of learn the side effect profiles of all of the medications. I would start early because there are quite a few psych medications, and whether you're going into pediatrics or family med or emergency medicine, or psychiatry, you're going to need to know these medications in all of those different specialties. So it's really good to just start to get a handle on these antipsychotic medications. Now, within the world of psychiatry, you can do outpatient psychiatry, you can do inpatient psychiatry. They're definitely very different, and you're going to use different medications for each one, but there also is a good amount of overlap. And so just for time constraints, I'll kind of leave those details out of this video, but like I said, happy to make another video going over psychiatry if you guys are interested. The next rotation was surgery, which was absolutely miserable. The surgical schedule is notorious. Everybody knows that when you're on surgery, you're at the hospital most of the time, and that's no different for a medical student. I remember waking up at 2:30 or 3 o'clock at the earliest for surgery. Most of the time, I was waking up at about 3:30 or 4 to get to the hospital at like 4 or 5 to also pre-round. So you need to go pre-round on those patients like we talked about for OB-GYN. And then you'll do rounds with your residents and the attendings. And then after rounds, you may have a couple minutes to get some breakfast, and then you'll go straight to the OR for surgeries. And then once your surgeries are done, usually you're assigned a room. And when that room is done with surgeries, generally you're allowed to go home. So it's kind of the luck of the draw. If you get a room that is operating until 5 or 6 in the afternoon, you could be having a 15-hour day, which is very taxing because, you go home at 6, 7, or 8 o'clock at night, and then you still need to study a little bit for your shelf exam, which I'll probably get into in another video. But you're exhausted from the day, and you still have to study for your shelf, and then you still have to wake up the next morning at 4 in the morning to do it all over again. And generally in surgery, you're at the hospital 6 days a week. I think that's extremely overkill, especially for the medical students not interested in surgery. But, it is what it is. And depending on where you are, it may not be that extreme, but I feel like the majority of surgical rotations are pretty intense. They're very long hours. So just be mentally prepared for that. The one piece of advice I would give you guys is surgery is all about anatomy. So the surgeons will pimp you on anatomy questions all day long. So know everything there is to know about the gallbladder, know everything about the appendix, know their blood supply, know complications. Those are the main ones, because if you're just in general surgery, you're going to do those a lot. And surprisingly, know a lot about breast cancer, because you're going to be doing a lot of lumpectomies. So you're going to be cutting out precancerous lesions, you're going to be cutting out lesions, you're going to be doing mastectomies. And so the residents are going to ask you guys questions about breast cancer quite a bit, which was a little bit surprising to me. So after surgery, I went into internal medicine. Now, internal medicine can also be inpatient and outpatient. And I did 4 weeks outpatient followed by 4 weeks inpatient. Outpatient internal medicine is super chill. It's very much like family medicine in that you're going to see a wide variety of pathologies, and people are going to come in with a bunch of complaints. I will say in internal medicine, outpatient, patients are going to have quite a bit of complaints and problems. And so you got to get good at getting a solid history in a quick amount of time. And then you're also going to have to learn how to actually present all of that information quickly and thoroughly to your attendings, because patients are going to come in with 6, 7, up to 10 or 12 complaints. And you're going to have to, present that information to your attending. So it's best to do it based on problem rather than doing, subjective, then objective, then your assessment and plan. Just do the problem that they're having, do a quick history on that problem. How long has it been going on? Have they been, treated for it in the past? Stuff like that. Tell them any physical exam findings based on that problem. Tell them what you suspect is going on, and then tell them how you want to go about treating that particular issue, and then move on to the next problem. That's how I would recommend doing it, but definitely ask your attending how they prefer that you present all of this information to them, because they may have a preference. So that's outpatient internal med. Inpatient internal med is way more intense. Those guys know a ton of information. They literally know everything that was probably on step 1 and step 2. They're so smart, those physicians. And they kind of have to be, because the patients that we send from the ER and have no clue what's going on, we're hoping that the internal medicine docs can figure that stuff out. So they have to be very smart to do what they do. So essentially your day is going to consist of rounding on your set of patients. So each doc can have up to 15 or even 20 patients at a busy hospital. So you're going to go round on all of those patients, generally with the attending, unless you're on a teaching service. Then you may pre-round, or you may just round with the residents, and then you may go around with the attending as a big group. So it's essentially the same stuff, guys. You're going to get a history and do a physical exam and come up with how you want to help that patient that day. Because generally these patients are going to be in the hospital for a few days. And so you want to little by little get them better each and every day by doing, little adjustments to their treatment plan. So those are kind of things that you guys can think about. It's going to be so hard to prepare for internal medicine, because patients are going to come in with so many different problems. Like, you're going to go from an alcohol withdrawal to a stroke patient to someone who, just had surgery to someone who's recovering from DKA. So you're just going to see a ton of different things, and it's going to be a great learning experience. But I really wouldn't start with this if at all possible, because you do need to have a decent background knowledge, and obviously the preceptors are going to understand that you're a third year, that you basically don't know anything. And depending on where you're at in third year, whether this is your first rotation or somewhere in the middle, they're obviously going to take it easy on you and not expect you to know stuff beyond your level of training. So if this is your first rotation, definitely don't stress out. The attendings are there to help you and teach you, and it's going to be a great learning experience, no matter which rotation this is for you. So those were the main core rotations that I did, and depending on your school's curriculum, you may be also required to do a rotation in like neurology or cardiology or some other subspecialty, but that was all I was expected to do. And then I had 2 months of elective rotations, and I chose to do emergency medicine for both of those months, and I'm 2 weeks away from finishing my third year and my emergency medicine rotation. So I've absolutely loved emergency medicine. It's the specialty I plan on going into. It's unlike any rotation that I've done so far, and I highly recommend you guys check it out, because it is quite unique. You don't do any sort of rounding, it's shift work. You don't need to follow your patients. It's super cool because patients come in with acute complaints, whether they're serious or just kind of ridiculous complaints. You figure out what's going on with them, you rule out life-threatening issues, and then you just treat them and send them on their way, or admit them into the hospital, or refer them to a specialist outpatient. It's pretty cool because you get to see an immediate change in these people's lives, hopefully for the good. They come in with pain or an issue, and if you're able to figure it out and solve it and make them feel better, then it's an awesome experience and it's an awesome feeling. And if you don't know what's going on, you're able to admit them to the hospital and allow the internal medicine doctors to kind of do their job and their specialty and kind of figure out, what's going on with the patient. The other thing that's really unique to emergency medicine is it's shift work. So you just go in for your shift. You know exactly when you're leaving because you know when your shift is over. There's no guessing. So guys, those were the rotations that I did during my 3rd year of medical school. I'm happy to jump into more details into each rotation. I briefly covered all of them. There's plenty of other things I can talk about regarding each rotation. So if you guys want to know more about something specific, leave a comment down below. And then I'll plan on making a video about the shelf exams, kind of how to prepare and what to expect from those in a future video. So stay tuned for that. So make sure to subscribe to my channel, guys, if you haven't already, and I'll see you guys in my next video.